Meanwhile, India's capital, New Delhi, has now reported its very first case of the monkeypox viral infection. The patient in this case is said to be a 31-year-old man from West Delhi who has had no history of international travel. According to reports that have come in, the man was admitted to a local hospital 2 days ago with a history of 2 weeks of fever and rashes. Although the man has no history of international travel, he reportedly had travelled to the northern state of Himachal Pradesh before falling ill. Delhi Chief Minister Arvind Kejriwal in his tweet had said that there is no need for people to panic and that the situation is still under control. Now remember, this is India's fourth case of the monkeypox infection. All other cases have been reported from the southern state of Kerala. The World Health Organization, meanwhile, has declared that the monkeypox outbreak, which is a public health emergency of international concern, and this came as the global cases of the outbreak are now set to reach the grim figure of 17,000. And our next report gets you all the details.
I have decided that the global monkeypox outbreak represents a public health emergency of international concern.
It's a label that's only been applied to the coronavirus pandemic and ongoing efforts to eradicate polio. But on Saturday, the World Health Organization said the rapidly spreading monkeypox outbreak represented a global health emergency. WHO Director General Tedros Adhanom Ghebreyesus explained why they were declaring the high alert.
We have an outbreak that has spread around the world rapidly through new modes of transmission, about which we understand too little and which meets the criteria in the international health regulations.
The label of a public health emergency of international concern is the WHO's highest level of alert, designed to alert governments that a coordinated international response is needed. Such an announcement could unlock funding in global efforts to collaborate on sharing vaccines and treatments.
WHO's assessment is that the risk of monkeypox is moderate globally and in all regions, except in the European region, where we assess the risk is high.
Members of an expert committee that met on Thursday to discuss the potential recommendation were split on the decision, prompting Tedros himself to break the deadlock, he told reporters. So far this year, there have been more than 16,000 cases of monkeypox in more than 75 countries and 5 deaths in Africa. The viral disease spreads via close contact and tends to cause flu-like symptoms and pus-filled skin lesions. Its recent outbreak has chiefly spread between men who have sex with men outside Africa, where it is endemic.
That means that this is an outbreak that can be stopped with the right strategies in the right groups.
But WHO officials said on Saturday they were exploring the possibility of the virus spreading via new modes of transmission. On Friday, the United States identified its first 2 monkeypox cases in children.
And we earlier spoke with Mr. Amesh Adalja, a senior scholar at the Johns Hopkins Center for Health Security in Pittsburgh, and this is what he had to say.
What the level alert means is that now the world's attention is concentrated on trying to contain this outbreak. As you said, this was declared for COVID, this was declared for polio, it's also been declared for Ebola, it was also declared for Zika, it was also declared for 2009 H1N1. So when that occurs, it signifies that there is urgent need to coordinate efforts to bring countermeasures and public health resources to bear to stop this public health emergency from continuing. So it does focus the world's attention on it. However, we've already known what we need to do for monkeypox. I think it's not going to change something in terms of the day-to-day operational needs, because we've already known what we need to do. We need to deploy the vaccine to at-risk populations. Because of the unique characteristics of this outbreak, the fact that it's spreading amongst men who have sex with men, it doesn't pose the same type of threat that other outbreaks have to the general public. So I don't think the general public needs to panic. But what we do need to do is make sure that governments are engaged so that they are testing people who may have been exposed or have symptoms of monkeypox and getting the vaccine to those populations in their countries that are at high risk. Because we don't want this to spread into the general public. We want it to be contained and we want to stop onward transmission. So we really need to take this vaccine, which we know works, and get it to the people that will benefit from it most.
WION is now available in your country. Download the app now and get all the news on the move.